Those comments come as the US is seeing an acceleration in the spread of coronavirus. There were more than 160,000 new cases on Tuesday, and 2,000 people in America died from COVID that day. North Dakota is one of the worst affected states, with the highest number of cases and deaths per capita. The BBC's Larry Madowo has been to one small rural hospital which is struggling to cope. Here's Larry.
We all love you. Love you too.
Diana Denault has just been allowed in to see her dad for the first time in almost a month. 75-year-old Dwayne Severson is finally doing better and no longer infectious after a bad case of COVID-19.
I didn't care about anything. So I didn't think I was going to make it. I kind of said goodbye to my family.
He's also been suffering from a broken heart.
Dwayne's wife died 2 years ago, so his coronavirus scare has shaken the whole family.
Every day when I would call Dad, he didn't sound like Dad. He was so weak. And his voice sounded so helpless. And I just wanted to run and hug him. I had COVID as well, so I was quarantined at home.
It is very hard for our families.
Unity Medical Center's capacity is just 14 beds, serving Grafton, population 4,200.
We've had to renovate some non-traditional rooms for patients, such as our chapel, our family waiting area, and currently our radiology waiting room.
But almost every patient here now has COVID or is recovering from it. More people are getting infected than they can deal with.
I've had to recently tell my staff I may not be able to honor vacation. That is really tough. My staff deserve their time off, and to not allow that, it's heartbreaking.
This small-town hospital doesn't even have an ICU. It was not built to take care of critical patients. But because of the COVID surge in North Dakota, they're using every available space for patients. And sometimes, when they get critical, they have nowhere to send them because the whole state is running out of hospital beds.
There are no ventilators here, but the mostly elderly patients need a lot of physical therapy. It is a long road to recovery.
I maybe was a little careless, but we were golfing every Wednesday, and when the weather got turned ickier, instead of golfing, we started playing cards, and that was not smart.
A full-blown outbreak is now tearing through North Dakota's small towns faster than it can handle. It has caught a sleepy state by surprise. A place where there are 2.5 times more cattle than people has become the COVID capital of America. The state now requires everyone to wear a mask, but at this cafe in another small town, it is a hard sell for some.
I just don't think it's necessary for that. I understand for everybody else's safety, but that's just my take on it. But I'm 22. I'm young and dumb.
Doctors think they know why North Dakota is so badly hit.
I think there was a feeling amongst many that being in a rural location protected you to some extent. We clearly know that's not true at this point. So I think that was it. And in the cooler weather up here in the Midwest has driven people inside, closer quarters. That's how respiratory type infections like COVID do spread.
At Unity, the patients keep coming. Every new arrival is assumed to be coronavirus.
This is your day every day?
Every day in the last few weeks. This is what it's been, yep.
With only 6 major hospitals in the state, most North Dakotans rely on small neighborhood facilities like this one.
Have you been around anybody that you know is sick?
I went up for communion, and then that afternoon we find out he had.
Healthcare workers in North Dakota fear the Thanksgiving holiday may bring another surge in COVID cases, pushing the system to breaking point. Larry Madowo, BBC News, Fargo.
The dire situation there with coronavirus in North Dakota.